Hi, my name is Kate Tomkinson and I am a secondary breast clinical nurse specialist. I am based at the Christie Cancer Care Centre at Wigan. This presentation will be focusing on looking after breast cancer patients following cancer treatment. So firstly, we know that more women are surviving from breast cancer. It's been estimated that by the year 2040, there will be 1.7 million breast cancer survivors in the UK, which is reflected there on the chart underneath. So more than 9 in 10 women diagnosed with breast cancer will survive 1 year after diagnosis. And 75.9% of women diagnosed with breast cancer will survive for 10 or more years, which is fantastic. So as GPs, the question that you must ask yourself when patients present in front of you is the patient likely to have metastatic disease from their breast cancer? So looking in the box, you can see, so at the top, we have the breast cancers that are less likely to metastasize. The top one, as you can see, DCIS, so ductal carcinoma in situ, what we know does not metastasize. So following down to the bottom of the page, the breast cancers that we know are more likely to metastasize are the more aggressive ones, which tend to be the triple negative and inflammatory breast cancers. Also, the patients that have node positive disease. And in the middle there, we have patients with HER2 positive breast cancers. So patient information about secondary breast cancer. So this is fantastic. All patients with a new breast cancer diagnosis are now entered onto a patient stratified follow-up programme. What does this include? Well, so a breast CNS will sit down with a patient for about 45 minutes. Generally, this is at the end of when the treatment is completed, ideally. This will include a thorough holistic needs assessment. And then following that, the patient will then receive in the post a copy of this and everything that's been discussed. And the GP, you will also receive it as well. And this is the treatment summary. The patients are advised or they're invited to health and wellbeing events, and they're advised to attend because they do get so much from them. And they following this, they then have open access follow-up, which is really good also. So information about secondary breast cancer. So this is brilliant. The patient feedback from this information is really, really good. They really find it helpful. And this is included in the treatment summary that is received by patients and GPs. It's an infographic and it's been produced by and designed by Jo Taylor, who is a service user representative living with secondary breast cancer. And she's a founder of ABC. So on here, so what's good to be aware of as a GP is the red flags for secondary breast cancer. And as you can see, there are five main areas that secondary breast cancer can appear. So we have the brain, the bone, the lymph nodes, the lungs, and the liver. And the next slide goes into a little bit more detail. So signs and symptoms of secondary breast cancer. So we have, so patients may present to you in your surgeries. So for symptoms related to the brain, we have a persistent headache, nausea, dizziness, maybe confusion, headaches, maybe more in the morning. That tends to be more, it tends to go on for more than 4 weeks. Confusion, neurological deficit. For the lungs, it may be that the patient has had a persistent non-productive cough, and that tends to go on for more than 4 weeks as well. Maybe some shortness of breath and pleuritic pain is quite common. With bones, so bony pain is really common, and again, it tends to persist. The pain can increase. It can be particularly in the axial skeleton, pelvis, ribs, and femur. And it's really important as well to be aware of metastatic spinal cord compression. With the lymph nodes, the patients may have noticed some new lymphedema or lymphadenopathy. And patients may present with right upper quadrant pain, nausea, anorexia, maybe just feeling generally off and unwell, and may have had some weight loss. And again, this could potentially indicate that something is going on in the liver. Just at the bottom there, it's just important to say that reviewing symptoms for a month will not affect the outcome. Okay, so investigations in primary care do not rule out secondary breast cancer. So we know that normal blood tests don't exclude metastases, and that includes normal liver function tests do not exclude liver mets. And that's the same for chest x-rays. They don't exclude lung metastases, and a normal x-ray doesn't exclude bone mets either. If a patient does have signs or symptoms of secondary breast cancer, it's important to point them in the direction of their secondary care team, and they can use the nurse-led open access service which is available to them. So adjuvant endocrine treatment. So 75 to 80% of breast cancers are estrogen receptor positive, and these patients will be offered endocrine therapy. As you can see across the side of the screen, we've got tamoxifen there and letrozole, and this will give patients a 31% reduction in recurrence, irrespective of their age. So the treatment may be tamoxifen in pre- and postmenopausal women, aromatase inhibitors just for postmenopausal women, and those women that are younger than 40 and are higher risk are given ovarian function suppression. Length of treatment, again, it can be 5 or 10 years depending on the risk of the cancer. Okay, so managing side effects of endocrine treatment, these can be really problematic and difficult to manage. So vasomotor symptoms, you've got sort of what's important here. We've got, advocating a healthy life, so trying to maintain a healthy weight, staying active, reducing alcohol, stopping smoking, sleeping advice, cooling pillows, fans, showers before bed. CBT and acupuncture can be really helpful. And then we have a list of medication that may be useful to prescribe. And also the list at the bottom is just to avoid, just because that can interrupt or interfere with the endocrine treatment. Monitoring bone health. So guidance for the management of breast cancer treatment-induced bone loss is published by the Royal Osteoporosis Society. There's a link below there. There isn't actually any requirement to obtain a bone density scan before starting treatment, but a baseline assessment, it is ideal that this is obtained within 3 months of commencing on the endocrine treatment. Monitoring and the treatment thereafter depends on the baseline bone mineral density, age, and presence of any major risk factors for osteoporotic fracture. Hormones after breast cancer, so HRT is not recommended. So in terms of contraception, the coil, but we wouldn't recommend any that have estrogen, progesterone in them. Barrier methods are advisable. Pregnancy, so it's usually advised to wait until at least 2 years after diagnosis, and stop tamoxifen, start folic acid. Consider staging, of course, and that again is dependent on the individual patient's risk. In summary, all patients are provided with a treatment summary that includes an infographic about secondary breast cancer signs and symptoms. If a patient has signs or symptoms of secondary breast cancer, they should contact their secondary team directly via the nurse-led open access service. There are multiple strategies to support women to manage the side effects of endocrine treatment. Secondary breast cancer infographic is available at www.gmcancer.org.uk. Thank you.